Hello and welcome to GP Notebook TV. My name is Anish Kotecha and I'm a GP in South Wales. Today I thought I'd discuss with you the nice rapid guideline on COVID-19 and its association with vitamin D. And this article was published in December 2020. So, as usual, I'm going to break this article down and give you some key take-home messages that I feel are important for us in primary care. Now, we all know there's been a lot of publicity around any potential association between vitamin D status and the severity of outcome of COVID-19 infection. And we're probably in general practice getting a lot of patients coming to us for advice around whether they should be taking vitamin D supplementation. And we thought it would be a really good idea to use this opportunity to highlight the UK government guidelines around vitamin D supplementation. Now, we all know that vitamin D is important for our bone and our muscle health and may also play a role in our body's immune system to respiratory viruses. The main source of vitamin D is obviously sunlight exposure, but there are a small number of foods that do contain some vitamin D as well. Now, what I'd like to do is give you 5 bullet points from the current UK guidelines around vitamin D supplementation. So, number 1, we should be advising our adult population, that's including women who are pregnant and breastfeeding and any children over the age of 4, to have 10 micrograms, which is the equivalent of 400 international units of vitamin D supplementation daily between the months of October and March. That's because there's reduced sunlight exposure during the winter months. Number 2, that very same population should be advised to take daily vitamin D supplementation throughout the whole year if they're at risk of having reduced sunlight exposure. This might be the frail or the elderly population that are housebound, those that are self-isolating due to the pandemic, or those people with darker skin tones as well. Number 3, all children between the ages of 1 and 4 should be advised to have 10 micrograms, again that's 400 international units of vitamin D daily throughout the year. Number 4, any babies between the ages of birth to 1 year old should be advised to have 8.5 micrograms, that's 340 international units of vitamin D daily throughout the year. That's if they're either breastfed or formula fed, but having less than 500 ml of formula milk a day. And that's of course because formula milk, if they have more than that, is fortified already with vitamin D. And lastly, point number 5 is that the current guidelines are that we shouldn't be offering vitamin D solely to treat or to prevent COVID-19. So why those doses? Well, those doses have been picked because the vast majority of people, and that's over 95% of people, will maintain their serum concentration of vitamin D above 25 nanomoles per litre using these doses. There is, of course, a problem with having too much vitamin D because it can cause hypercalcemia, and this can affect kidney and heart health, as well as weakening our bones. Now, we should be cautious about giving vitamin D to those with sarcoidosis, and regular blood monitoring is important for those that have evidence of any renal impairment as well. Now, importantly, when we're prescribing vitamin D, we should be aware if our patients are vegetarian, because some products do contain animal derivatives, and we should be suggesting alternatives if that is the case for our vegetarian population. So, we know that a low vitamin D status is associated with poorer outcomes from COVID-19 infection. But to confirm causality is quite difficult because we know that an inflammatory response, as seen in COVID-19 infection, can lower vitamin D levels. So whether low vitamin D levels are associated with poorer outcomes of COVID-19 infection or vice versa is difficult to know at this stage. Now, there have been global studies and meta-analyses looking at using vitamin D for treating and preventing COVID-19 infection, but NICE have recommended that either the evidence is not strong enough yet, or actually the population used and the evidence gathered isn't actually directly transferable to our UK population. And so NICE have actually come out and said, for now, there's not enough evidence to either use vitamin D to prevent COVID-19 infection or treat COVID-19 infection. But they have said that more research is needed, of course, in this area. So let's summarise this article. Although NICE have said that vitamin D supplementation shouldn't be used solely to treat or prevent COVID-19 infection, there's clearly a lot of publicity around this area, and we are likely to find a lot of patients coming to us or continuing to come to us for advice around this area. And therefore it is important to remember the UK government guidelines on vitamin D supplementation for our adult or elderly population, or those that have risk factors of a deficiency of vitamin D, and supplementing these in the correct way. I hope you found this video helpful, but please do continue to tune into GP Notebook TV for further videos. Thank you very much.